We had Intalere come in and do an assessment about 2 years ago. And from that, I mean, we had already thought that we needed to centralize distribution of pharmaceuticals because Crystal Run Healthcare is growing constantly. And the format that we had in place just wasn't going to grow with us. So we knew that we had to centralize it. So having the backing of Intalere's assessment was great to help Kevin and I to move forward with this project.
Crystal Run is made up of a lot of clinics, probably 23 different buildings, different locations. And what we did was, rather than ship to all of those 23 locations, we decided that we would ship to one location and find space to make it a central pharmacy. And we tried to find something geographically centered amongst our area. So we found space. We constructed a central pharmacy at minimal costs. We used a lot of equipment we already had, refrigerators and such.
From an inventory standpoint, we were able to buy a little bit larger quantities centrally that allowed us to break them up. Vaccines were a big one. We could stay on top of vaccines. We constantly were running out of vaccines in certain areas of our practice, and it was just because of sheer volume of vaccines and the approval process that was in place before centralizing the distribution was difficult to get large quantities of expensive medications approved, whereas through the central distribution of the pharmaceuticals, we could house more larger quantities of more expensive items that we could get turned over very quickly.
Actually, an outcome that we didn't expect was satisfaction from our end users. They actually loved the fact that they were getting their pharmaceuticals the next day. The old ordering process, it could take 2, 3, 4, 5 days sometimes. So that was something we didn't expect. So that was great. We also probably are going to save somewhere in the neighborhood of $1 million a year, just because we cut inventory down. And we also took a 6% basically price reduction in our supply costs. The other thing that we also will accomplish through this is our code cart medications might have been, maybe we need 1 or 2 here and there, and you have to buy in a pack of 25. So we would wind up buying this pack of 25, and sometimes we would have to waste some of those because we didn't use them all in time. So now, by having it in a central location, you could send 4 here, 5 there, 3 there, 2 there, or whatever, and we were cutting down our waste as well.